Hi guys, this is Maureen, a fifth year medicine student from MNCAH University. We shall be continuing with our series on HIV, and today I'll be discussing elimination of mother to child transmission of HIV, that is eMTCT. So the various things I'll be talking about are, as I already told you, eMTCT, PMTCT, that's prevention of mother to child transmission, and we shall say that it's still under eMTCT, which is the broader aspect. We shall see also the integration between eMTCT and maternal, newborn, child, and adolescent health. So what's the take of WHO on eMTCT? WHO works with partners, one, to set goals for prevention, care, and treatment of mothers, pregnant women, and their children. Second, WHO also develops evidence-based strategies, defines goal targets, baselines, and indicators that promote the integration of PMTCT into maternal, newborn, and child health services. Before we dig into the eMTCT, we need to understand, so why do we need the elimination of mother to child transmission? Without any intervention, mother to child transmission contributes to 15 to 45% of the HIV infections. But with effective intervention, we can have these rates reduced to less than 5%. This eMTCT strategy comprises of 4 interventions. These interventions are not offered independently, but simultaneously with the MNCAH services. Maternal, newborn, child, adolescent health services include various services, though not limited to antenatal care, labor and delivery, adolescent clinics, sick child clinic, young child clinic, and these services are offered at healthcare facilities and in the community. These may not be limited to HIV prevention, but as we are offering these services, we can incorporate the eMTCT Continuum. Integrating eMTCT and MNCAH services, as I already discussed, the different services that are offered, like for example during the adolescent clinics, these adolescents are also given different HIV services like screening, counseling for those who are already HIV positive. In that way, you're providing the eMTCT services alongside the specific services offered in those special clinics. The eMTCT Continuum services are offered at 4 different levels. They are offered for non-pregnant women and adolescents, during pregnancy, during labor and delivery, and during postpartum period. During pregnancy, the triple elimination initiative is employed. This involves HIV, syphilis, and hepatitis B screening and treatment. So after testing for HIV or syphilis and the mother is negative, retesting after 3 months is mandatory. Still during pregnancy, for mothers and basic HIV care is offered. Other services include infant feeding, counseling and support, and viral load testing for those mothers who are already HIV infected. During labor and delivery, we offer the provider initiative, HIV testing and counseling. This is given to mothers who have never tested for HIV or those who tested negative more than 3 months ago. Emphasis on safer delivery services so that there is reduced risk of exposure of HIV to the newborn. Antiretroviral refill And adherence counseling is also done during labor and delivery. ARVs to the newborn and nevirapine prophylaxis can also be done during the labor and delivery stage. And finally, we have to offer BCG or polio vaccination. And during the postpartum phase, we still offer the provider-initiated HIV testing and counseling, just like during labor and delivery and during pregnancy. On top of that, routine immunization and growth monitoring, infant and young child feeding counseling services are also offered. Early infant detection and initiation of ART for these infants who are already infected should be emphasized. And then we also have the ART and septrin refill adherence counseling services on top of family planning and contraception methods being discussed with the mother. Thank you for listening.